Hi, this is Dr. Johnny Liu from Doctor's Choice, and we're going to talk about special election periods today. I know that we've covered this topic in the past, but I felt like it was important to cover it again, especially with what's happening in the Medicare space. So a lot of our clients are facing doctor network changes throughout the country. We've got insurance battles with many of the big hospital systems. Just in the Northeast, what we saw was in Rhode Island, with UnitedHealthcare and the Brown healthcare system, which affects a lot of our clients. UnitedHealthcare Medicare Advantage programs are not recognizing Brown hospital systems as part of the network anymore for Medicare Advantage, which means that patients that have received care from there, unless it's medically necessary from a continuity of care perspective, they're not going to be able to keep their hospitals. And also, we're seeing other parts of the country, Danbury Hospital, Johns Hopkins had a falling out, Sloan Kettering with several insurance companies, although that's been mended. So those folks are going to be safe for now. So we're seeing a lot of this happening across the country where hospital systems are negotiating with insurance companies. They're getting to an impasse, and they always say it's like quality of patient care, right? But ultimately, it comes down to money. Hospitals don't feel like they're getting paid enough. The insurance companies don't want to pay all the extra charges, and because either they can't pass on those costs to the members or it's a government program that limits how much they're getting paid. So at the end of the day, if the money doesn't work, that's when the cords are cut. And the money really happens in two buckets. One is fee for service, how much hospitals or doctors are being paid per service, and then also there's value-based payments, which is if you meet these certain targets, then we'll pay you a little bit extra. And that's a lot of times that cuts out a lot of the smaller guys from a provider perspective, because they don't qualify for a lot of value payments, and that's where a lot of the hospitals make their margin is on these value payments. And what's been happening in the past decade is that there's a big game of gaming these value payments, upcoding and all. That's why you see the Department of Justice, those fraud investigations where hospitals and insurance companies were saying, well, this patient, borderline diabetes, well, they have diabetes, and because of that, we can charge more for the government programs. That was happening a lot. There's a lot of crackdowns on that. So a lot of funding's going away. A lot of that well is being dried out, and that's why you're seeing a lot of these negotiations break down. So what does it mean for the consumer? And it gets messy. So, for example, in the Northeast, for Rhode Island, for example, there's going to be a special election period for people that are affected. So what a special election period does is it allows people who are on Medicare plans, oftentimes Medicare Advantage plans, to switch plans midway through the year. Oftentimes what happens is that if there are changes and there's no special election period, folks have to wait until the annual enrollment period, which is October 15th to December 7th, in order to switch their plan effective for January 1st. So, but if somebody has a election period, they can switch midway through the year. So in this case, for a lot of these network shifts, what happens is that Center for Medicare and Medicaid Services, they'll grant a special election period, but it's not to everybody. It's only to the specific people that they deem are affected. So in this case, it's people who have recently received healthcare from those hospitals will be granted a special election period. Well, how do you know? So United, in this case, will send out a letter to affected members. And once you get that letter, you typically have a 60-day election period to switch to another plan if you want to keep going to the same hospitals. And what we've seen is that certain people that have not used those hospitals got those letters. Certain people that have used those hospitals did not get those letters, and they call and they say, and they're being told that they don't qualify for the special election period. So it can get messy, and it's on a case-by-case basis. And in these cases, what we suggest people to do is simply, if they're not getting the answers, if they're getting the runaround, do look at other options. See which other plans will cover your doctor or your hospital that's being dropped, and then give Medicare a call, because Medicare ultimately, 1-800-MEDICARE, has the final say in whether they will grant an exception to that special election period. So in that case, what we've had people do is, they didn't get the letter, they were told that they were not eligible by the insurance company. They call Medicare, they explain their situation, the Medicare personnel files an appeal, or they grant a one-time special election period allowing that person to switch. But they've got to do it through Medicare. Does that cut out the insurance agent? Absolutely, but I think we're sort of the lowest on the totem pole in terms of concerns at this point. So that's what we would consider folks do if you're in a situation where your doctor's dropped, is see if you have a special election period, and if you don't and you feel like you should, then call Medicare.